Hello everyone. This is just a follow-up to my prior video where my pain management doctors wouldn't listen to me. I just wanted to let you know, yes, this is a smile on my face. I did manage to get heard. I did manage to get them to listen to me. My nurse spoke to the charge nurse, who spoke to the doctors, and told them that I needed to speak to them again. I got a different pain management team. The other one was a palliative care management team. The team that decided to really listen to me was the acute pain management team. So they came in, and they had come in the morning and spoken to me, but I'm not a morning person. And they came in right at 8 o'clock, and I had just gotten up and I was still groggy, and all I heard was womp 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 pain, womp 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 medication, womp womp womp, we're extending this, womp womp womp, we're reducing this, womp womp womp, we're increasing this. And I wasn't in the capacity to process what they were saying. And by the time I processed what they were saying, they were gone because they were doing their rounds. So they were kind of in a rush. So they came back and we had a discussion. And they listened to me. They listened to me saying, look, I have gastroparesis. When you give me pain pills, it takes longer to break down and go into my body because it just sits there. It takes longer to absorb. So I'll be in pain for hours before the oral pain pills kick in. So they are giving me back the IV pain med as a primary, and then they're going to give me the oral pills for breakthrough pain, whereas before they had it the other way around. And I said I would prefer to have my pain, because what they were trying to do was give me the oral pain pills for my pain, hoping that would build up in my system, and give me the IV pain meds for breakthrough pain, since that gives immediate relief. But what I said to them is, I need immediate relief when I'm in pain, and then I can take the oral pain pills on a schedule so that I don't have the breakthrough pain. And they agreed to that based on my body and how I process pain and how I process medication. So I was my own advocate, and then the nurse and the charge nurse further advocated for me, and they got the pain management doctors here, and they listened to me, and we had a good conversation and explained to them that I want to work with them as a team because I know my body. And they agreed. They're like, you know your body, you know your pain, you know what works for you. So you tell us what works for you, and we'll work with you to figure out how to make that work, which is what I needed and what I wanted. So I'm a very happy patient. And that's why it's so important that we advocate for ourselves, is because in advocating for ourselves, we're also kind of advocating for others, because now these doctors are going to take what they learned from me and they're going to use it to help other patients, because they're going to learn not every patient is the same. Not every patient processes pain the same. And I think they also realize that sometimes patients don't hear what they're saying because they're either under pain meds and they're not quite fully lucid, or they're just waking up. So, sometimes we aren't able to communicate because we're not in that space when they come in. So, once again, I'm reiterating the fact that it's important that we advocate for ourselves, and we know that we need to be able to communicate and have conversations with our doctors, which means that not only do the doctors have to listen, but we have to listen as well. And we have to be in a space where we can communicate how we feel, what works for us, what we're experiencing, Doctors aren't mind readers. They're also not perfect, but neither are we. And as patients, we learn. As doctors, we learn. So I just wanted to give this follow-up and let you know that my self-advocacy has once again worked. And sometimes it can be frustrating and tiring, especially after suffering for so long and going through so much. But we have to keep pushing, and even when we're tired, we have to fight. Even if we're not fighting an illness, we have to fight as a patient to recover, to be heard, to be seen, to be understood. But it's also very important. Let me add this at this point. I have a neighboring patient who makes me feel like I'm not on an oncology ward, but in a psych ward. She is constantly screaming out to the nurses. I'm all the way at the end of the hall, far from the nurses' station. So is she. And she screams out to the nurses so they can hear her from the nurses' station, which is also, it's not only distracting for the nurses and frustrating for the nurses because she's calling every 5 minutes, screaming out in pain. It's like she doesn't sleep. It's like 24/7. But it's also disturbing other patients. So we as patients, even when we're in pain, we need to be considerate that these nurses are doing all they can to make us comfortable and to try to get us our pain meds and our other meds as soon as they can. Sometimes they always have other patients. We're not the only ones. We have to be considerate of that. We have to be considerate of other patients. And even when we're in pain and we're suffering, we need to try our best to not take it out on the people who are trying to help us. We need to do our best to not disturb others who are also suffering and just trying to get some rest, which is hard to do in a hospital. It's 2:00 in the morning, and that's the only reason why I have some quiet, and I don't have people coming in and out, and it's somewhat quiet on the ward. It's hard being sick. I know. It's hard suffering. I know. I've been through it. I'm still going through it. It's tiring. It's frustrating. It's enough to make you angry and miserable, but being angry and miserable isn't good for us to try to recover. And being angry and miserable doesn't help those who are trying to help us. And it kind of makes them not want to help us. So even when we're suffering, we need to find a way to communicate without yelling and screaming and being miserable. And we need to try to be good patients, because nurses and doctors really do try to help us. They do their best. Especially these nurses, they have a difficult, tiring job. And without these nurses, I don't know where I would be. They have helped me so much, especially in this hospital stay during COVID, with this variant going crazy and rampant in the city. They have been extraordinary in making me not feel isolated because I can't have visitors, and helping me when I'm down and I'm crying and I'm terrified. I had a scary event earlier today. I started having really bad tremors that went from my hands shaking to my legs shaking uncontrollably. And the more I tried to stop it, the more it would get worse. And then eventually my whole body was shaking from the tremors. And there wasn't anything to explain it. I've never had tremors like that. I have neuropathy, so I'm used to my hands shaking a bit. But it was a really scary experience. And you know who got me through it? My nurses were here first. and they held my hand and they reassured me. And when I started having anxiety and panicking because of what was happening, which didn't help the situation, they tried really hard to calm me. And then I had a doctor, Dr. Salter. He's an amazing doctor, wonderful bedside manner. And he stayed calm. He helped to calm me. I had my mom on the phone. He reassured her. He reassured me. And he called the neurologist. They came in and they assessed me. And I tried to stay calm. And as I calmed, things kind of got better. They realized that the tremors weren't a panic attack. They believe that it's partially due to my neuropathy, and that it's also due to all the stress that I've endured over the past 6 months since June, or since May. Stresses at work, stresses in my personal life, stresses with health. So, yeah, I've been under immense stress, and I guess today, I don't know what triggered it, but my body just said, no more. And so I now need to go into stress management mode. But I just wanted to let you guys know that I did get heard, and I did get seen, and the doctors did listen to me, and the nurses helped, the doctors helped. I advocated for myself, and the self-advocacy is where it started, and the doctors listening is where it ended. So I'm much happier. I am no longer in pain. I think what we have come up with for pain management schedule and therapy and schematic and plan is working, and I'm hoping it will continue to work, and I'm hoping we can continue to work together to get my chronic pain and illnesses under control. I really do like this hospital. Yes, I've had a couple of bad experiences, but nobody's perfect, and I'm doing my best to make this hospital better, and the doctors better, and the nurses better. I'm trying to be better as a patient as well. And patient advocacy, self-advocacy, it not only helps us as a patient, it helps the doctors to be better, and helps the hospital to be better, and everyone learns from having conversations with the doctors and communicating. And so it's a really healthy thing, and it's really important. And I know that in my culture, being a minority, being somebody of African descent, being Jamaican, being from a family where one side is Chinese Jamaican, culturally, we don't communicate with our doctors well because we feel like we can't question the doctors. We also have had, as people of color, we've had a history of a bad history and experience going back hundreds of years. Bad experiences with the medical industry and medical experts, and we have to get over that. This is a new era. This is an era of us fighting for equality, fighting to bridge the gaps, fighting medical disparities, fighting medical mistreatment. This is a time for us to understand that in order to be seen as equals, we have to speak up for ourselves. And we have to do so in a respectful, calm, and educated manner. That is our responsibility. That's how we erase stigmas. That's how we erase stereotypes. That's how we stop being marginalized. And being like what I'm doing, being seen, being heard, that is how we help people who are underrepresented, is by representing them. And that's what I'm trying to do. I'm trying to, sorry for the shaking, I'm trying to represent not just myself, but others like me. And there aren't enough people doing that. And so we need to know how to make our voices heard. And I'm trying to be a voice for myself and help others to have their voices too. So that's where I'm coming from. And that's my place right now. And I'm hoping that I'm helping. I'm hoping that I'm helping others not only to learn, but I'm hoping that I'm helping others realize that they'll get through this. I'm hoping that I'm helping others who've been suffering alone, feeling isolated, feeling unheard, feeling frustrated, feeling tired. Being sick isn't easy. It's really hard, not just physically, but mentally and emotionally. We have to keep pushing. We have to keep surviving. We have to keep thriving. And we have to keep living. So let's keep effing going. I love y'all. And I hope I helped somebody to feel better. I hope I helped somebody to know how to be heard. I hope I helped somebody to speak to a doctor today and to communicate. And I hope I helped somebody to be a better patient, to be a better doctor, to be a better nurse, to be a better person. Like I said, I love y'all. So keep effing going. Keep surviving, keep thriving, keep living. I'm going to reiterate that. It's important. I love you. And thank you for all your support. It means the world to me. It makes me realize I'm not alone. It makes me realize I'm loved. It makes me realize that I am helping people. I'm still relevant. And I still have a place in the world and in this community. And that really helps me. So helping you has helped me. And you have helped me to be here to try to help you. So thank you for all of that. So let's keep going, all right? Bye.